Greetings, everyone. The scientist we are discussing this month is August Bier. Dr. August Karl Gustav Bier. He is a German surgeon, father of spinal anesthesia, and famously known as the first surgeon of Imperial Germany. He is a former assistant to Johannes Friedrich August von Esmark. The Esmark tourniquet formed the basis of his eponymous Bier block regional anesthesia. Dr. Bier is remembered for his multiple advancements in anesthetics as well as in surgery. He is a philosopher, an environmentalist, and a self experimenter. Dr. Bier was born on November 24, 1861, in Helsen, Germany, to Christine Becker and Theodor Bier. He has three siblings. He graduated from high school in 1881 and was accepted to medical school at the Humboldt University of Berlin, Germany. Following his graduation, he worked as a general practitioner in a small town of Gettorf, Germany. Though he started his medical education from the University of Berlin, he was transferred to the University of Leipzig and then to the University of Kiel, where he famously stated that he moved there not for the sake of science but the sea and marine life. Bier accepted a residency under Friedrich von Esmark at the surgical clinic in Kiel. Under his mentorship, Bier managed the clinical transition of operating theatres from antiseptic to aseptic systems. In 1889, he achieved his habilitation with a thesis on circular sutures on the intestine. Coming to the origins of spinal anesthesia, Dr. Bier worked with Henry Quincke, a surgeon who developed a procedure to remove the cerebrospinal fluid from spinal canal. During this time, Bier considered the effects of using this technique to administer anesthesia. He hypothesized that a small injection of anesthesia into the spinal canal could suppress pain sensation to perform a major surgery. Quincke's 1891 refinements of lumbar puncture provided the physiological foundation for Bier's intrathecal injections. Bier performed the first clinical spinal anesthesia using a 0.5% cocaine solution on a 34-year-old patient. On August 16, 1898, Dr. Bier injected cocaine solution into the man's spinal canal and waited 20 minutes before beginning the amputation. According to Bier, the man reported having no feeling in the lower half of his body, remained conscious throughout the operation, and informed Bier that he felt no pain. Bier also noted that the patient couldn't move his limbs throughout the procedure. Following the successful procedure, Bier repeated the anesthetic technique on five other patients. All of the patients reported vomitings and severe headache that lasted for a week. He hypothesized that those side effects resulted from the circulatory trauma to the central nervous system or excessive loss of CSF. Dr. Bier is famously known for his self experimentation. Following his first six successful spinal blocks, Bier and his surgical assistant August Hildenbrand experimented on one another to confirm the post surgical side effects of nausea and headaches. The first attempt on Bier failed due to a critical clinical error. The syringe did not fit the needle, resulting in a significant leak of cerebrospinal fluid and cocaine. Subsequent successful trials proved that a minute dose of cocaine could produce dense surgical analgesia in the lower two-thirds of the body within minutes. Both men suffered for a week from severe post-dural puncture headache, which Bier correctly attributed to the loss of CSF. Another anesthesia technique Dr. Bier is famous for is his intravenous regional anesthesia. On April 22, 1908, at the 37th Congress of German Society of Surgeons, Bier demonstrated intravenous procaine analgesia by performing a lower limb amputation and also a resection of an elbow. The procedure required minimal equipment, avoided a general anesthetic, and provided a blood-free surgical site. He presented a series of 134 cases in a German journal, in which the anesthetic effect was described as good in 115 cases, satisfying in 14, and insufficient in 5. The original technique involved exsanguination of the limb using an S-mark bandage, followed by the placement of proximal and distal tourniquets to isolate the venous segment from anesthetic injection. Despite its efficacy, the technique fell into disuse for decades due to concerns over systemic toxicity. It saw a major renaissance in 1960 with the introduction of safer local anesthetics like lignocaine. Bier's assistant Fritz Momberg published a modification of the technique to reduce the pain caused by the proximal tourniquet. He suggested the placement of a third tourniquet distal to the first one, allowing the first tourniquet to be removed and alleviate the pain. It was later further simplified by Charles Mackinock Holmes. Mr. Holmes used a single sphygmomanometer cuff, which he placed high proximal and inflated to above the systolic blood pressure, used a fine needle with a convenient vein, typically on the dorsum of the hand, and used a relatively safer 0.5% lignocaine. Dr. Bier studied hyperemia, the therapeutic increase of blood supply to tissues. He believed controlled hyperemia could improve healing in infections, tuberculosis, chronic inflammatory conditions, elephantiasis, parotitis, etc. During World War I, Bier joined the German army as a consulting surgeon. He found that the shrapnel and grenades often caused severe head trauma and introduced a new idea of steel helmet to alleviate the risk. Collaborating with Frederick Schubert, the military physician, Bier developed the M16 helmet to replace the inadequate leather headwear of the German infantry. He also founded the German University of Physical Education in 1980, viewing exercise as a clinical necessity. An ardent environmentalist, a pioneer in ecology, his Sawn Woodland project transformed his estate into a master class in forest biology. Dr. Bier is deeply influenced by the Hippocratic thought, and he supported the Schultz law, defined by the quote, weak impulses light vitality, medium ones enhance it, and strong ones omit it. Dr. Bier was adorned with a lot of awards and honors. The highest German award for researchers, the Elderchild or the Eagle Shield Award, Hitler's state-sponsored substitute for Nobel Prize, the German National Prize for Arts and Science. For his work in hyperemic therapy, he was awarded the Cameron Prize by the University of Edinburgh and an honorary doctorate. Honorary memberships in the Society of Surgeons, Scottish Society of Surgeons, and the Royal College of Surgeons were also awarded to him. These were a few professional appointments and roles held by Dr. Bier. Dr. Bier stepped down from his prominent position as chief surgeon at the Charité University in Berlin and retired as a professor emeritus. He relocated to his 828-acre forestry and woodland estate in Sawn, devoted his later years to studying ecology, forest preservation, and philosophy. He passed away on March 12, 1949, due to pneumonia. Thank you. Let us meet with one more scientist in the next session.